You're listening to the JA Talks podcast, created by JA patients for JA patients and the people who love them. Here, learn what it's like to be diagnosed with juvenile arthritis at a young age and tips and ideas from our hosts and guest experts.
Welcome to the JA Talks podcast, a spinoff of the Live Yes with Arthritis podcast. We are so excited to have this podcast because juvenile arthritis affects over 300,000 children in the United States. You heard that right, kids get arthritis too. My name is Bailey Bowman. I'm the Integrated Marketing Manager at the Arthritis Foundation, and I was diagnosed with JA when I was 8 years old. In this first episode of the JA Talks podcast, I want to introduce another JA patient and longtime Arthritis Foundation volunteer, Kate Wingate. This whole podcast was Kate's idea that she brought to us, and we are so excited to have her join us and start this discussion just specifically for kids with JA. Kate will be hosting this JA Talks podcast, and we'll be having roundtable discussions with guest experts and others affected by juvenile arthritis. Kate, welcome to the podcast.
Hi, Bailey. I'm so excited to be here. I am so ready to get started.
Perfect. Well, tell us a little bit about how you came up with this idea and where you want to see this podcast going.
Yeah, absolutely. I was diagnosed with juvenile arthritis when I was 18 months old. So I have both the blessing and the curse of knowing everything that can come with this disease. And I have found that as someone who has grown up with this disease, going from 18 months old to 18 years old, that a lot of the material can be directed towards parents, simply saying, what your child is to expect or what to expect as a parent of someone with JA. And as someone who has had JA for as long as I can remember, it doesn't affect our parents. It affects us. And so I thought it was really important to show other kids what to expect with JA and to really be a resource that I feel is needing in this community.
I completely agree. A lot of times you're sitting in the doctor's office and the doctors are talking to your parents when you're the one that has to deal with it every day. Can you share a little bit about your diagnosis journey, kind of, when you were diagnosed, how you were diagnosed, what were the first symptoms, things like that?
Yeah, absolutely. So when I was 15 months old, I had just begun to walk. My parents noticed that while I had learned to walk, maybe a couple months ago, I reverted back to scooting. And so I was scooting around everywhere. I wasn't really putting pressure on my legs. And then my right knee swelled up to the size of a baseball, which on a baby is quite large in proportion. And so obviously they were very alarmed, took me to a lot of specialists. And, I think the worst part about a diagnosis journey with JA is that there is no test, right? They can't take blood work and be like, oh, you have arthritis. No, it's a series of trials and errors. And so we certainly went through that. We got told that there was nothing wrong with me, that I was just being a kid. But ultimately, we got admitted to the rheumatology clinic at Duke Children's Hospital because my grandmother knew a cardiologist that worked there and baked him cookies. And while we had been told that it was a couple months away, we got in within the next couple weeks because of my grandmother's fabulous chocolate chip cookies. It was really, that's the power of chocolate chip cookies.
Always.
So I got seen by Dr. Rabinovich. I was officially diagnosed with arthritis, and I've been at Duke ever since and involved with the Arthritis Foundation for a significant part of my life.
And that's kind of, although I got diagnosed at 8, it's kind of a similar story for me where all of a sudden my knees were the size of baseballs. So mine was actually, I was 8 years old and I had just gotten my first horse. And I started riding horses, and all of a sudden I couldn't pull myself up on my horse anymore. My knees swelled up to, again, the size of baseballs, and mine were probably softballs because they were pretty big for me. I don't remember a lot of the process of getting to primary children's, but I was very lucky, and I live in Utah, and so the University of Utah has Primary Children's Hospital, and they have a fantastic rheumatology department. And so I don't know how long necessarily it took me to get into a rheumatologist, but as soon as I did, it was a game changer. I was able to continue riding my horses and play sports and do all of the fun things. But it's a total life adjustment when you are diagnosed with arthritis. And we kind of have the same but different situations because you don't know anything besides it. And I knew a little bit of life before arthritis, but I mean, do you really remember much before you were 8? Let's be honest.
No, yeah, for sure. I have the benefit of not knowing life without JA. I have a friend who was diagnosed at 9 and remembers life very clearly, and it was a complete change for her. But as someone who has grown up with JA, I kind of feel like I have the privilege of not knowing what it was like before I had this disease. And so in some ways, I think I'm really lucky. In some ways, why did I get it as an 18 months old? We'll never know.
Right. Well, you mentioned growing up with arthritis. What was that like for you? And what kind of things do you think it impacted or maybe made things a little bit better or worse, in your opinion?
Yeah, absolutely. My parents, I remember, first enrolled me in kind of our district public school for kindergarten. The problem was that I was either in a flare or something was going on. I remember distinctly that I was on methotrexate at the time. And if anyone is listening who has been on methotrexate, you know that that is not a fun drug. I mean, for years afterwards, I would associate the color yellow with nausea. I mean, it was significant. So in kindergarten, I would either have pain or feel the side effects of methotrexate, and I couldn't go to a nurse. The nurse was there like every other Wednesday. And so my parents very quickly realized that I needed somewhere that had more access to care. So they did enroll me in a private school. And in that way, I am so privileged and so lucky because I've been at that school for my entire life now. I'll be graduating in May from that school. So that was really great for me because that also meant that I could, take a book by the Arthritis Foundation that was, I remember it exactly. It was Raising a Child with Arthritis.
Mm-hmm.
And my parents would dog ear or mark a specific section, highlight things that applied to me. And I would take in the book, give it to, say, my third grade teacher and be like, hi, I have arthritis. This is what you need to know. At summer camp, my mom would always say she has arthritis, but no restrictions unless she tells you. I had a very high pain tolerance from a very young age. And so when something was wrong, it was wrong.
You could tell.
You could tell. If Kate was complaining about something, it meant something was very wrong. So yeah, growing up with arthritis, I have had a lot of privilege in having the access to care that I do. My hospital is in Durham. I live in Greensboro, North Carolina. So that's not too far away. I've always had access to care. I've been surrounded by people who love and support me. But, growing up with a disease as a young kid still is not necessarily a privilege in and of itself. I got lucky to have the resources after my diagnosis, but I certainly did not enjoy flares when they happened.
Right. Yeah. And that's really interesting too, that you were able to go to the private school and have all of those resources. And I think something that is very useful, but also not necessarily important. So if there's anyone listening that's like, there's no way I could go to a private school, there are opportunities for you at your public school. I went to public school my whole life.
Absolutely.
And like you mentioned, also the Arthritis Foundation has really great resources that you can take into your schools and your doctors and all of those different places. And the one that you mentioned, Raising a Child with Arthritis, that is part of the Arthritis Foundation's Power Pack. So if anyone listening doesn't have a Power Pack yet, get a Power Pack.
It's free. It comes with a teddy bear. It's the best.
They have different age groups. So if you're like 0 to 8 years old, 9 to 13, and then 13 and up, they have different age grouped Power Packs for everyone. But like you said, there's great resources and really ways that you can fight for yourself and be your own best advocate. How do you like to tell your story about having arthritis? Like if you had to tell someone, that's newly diagnosed, how to talk to, say, their teachers or their friends at school, what advice would you give them?
I became an extrovert very quickly. Um, I don't necessarily know if I was more shy, if I would have spoken as much as I did. Now, to be fair and to be realistic, not everybody that has arthritis can do that comfortably. And I absolutely understand that. I just got lucky in that my parents raised me to be very outspoken. I went to school with a lot of the same kids I had always gone to school with. And so telling them was more, I have this thing. It doesn't really affect me, except, when it's Jingle Bell Run season and I want you to come join my team. But telling teachers was different, right? Because they had the authority and also the responsibility then to make sure that I was doing okay. And a lot of the times I was, but I flared pretty badly in fourth grade. So I could not do PE, for example. And so instead, I would help create like little QR codes for the art show around campus while my classmates did PE. But that was still, I was missing something. Now, I never liked PE, but that's besides the topic. I felt lucky at the time, but I was missing that interaction with my peers. But I find that if you really have to advocate for yourself in a space, like a school or even in the doctor's office or telling family, the most powerful thing you can do is to say things in your own words, in your own terms. You don't have to come out here with your full diagnosis of polyarticular juvenile idiopathic enthesitis related arthritis, for example. You can just say, hey, kids get arthritis too. This is how it affects me. Either my knees hurt, my fingers hurt, whatever. I will tell you if something's wrong. Usually I would be very vocal if something was wrong. And a lot of times if something was wrong, it was a side effect of methotrexate, not necessarily my disease. And so that was a learning curve even for me of having to figure out what is arthritis, what is normal person pain. You know what I mean by that, Bailey, right?
Yes. I think anyone with arthritis understands what normal pain versus arthritis pain is.
Yep. It took me years to figure out what the distinction was, but really having this disease turns you into a self-advocate. You know your boundaries best. Even if your parents are helping you, you still know yourself best. Speak up for yourself. You know your limits. If you want to push, you can. Just know, what that entails for you, what that means, what the consequences of maybe trying to blend in are. I have always found that as somebody with arthritis, I went through periods when I didn't tell anyone. Like I went to a summer camp and I didn't tell anyone until the last day because it was a sports camp. And they were like, wow, I had no idea. And I was like, that's the point. I didn't want you treating me differently. But I would say the best thing is to be as transparent as you're comfortable with, but also know your own limits. Figure out what works for you, not what necessarily is more convenient for other people. You are your own best self-advocate. So use that power.
Yeah. And I think you brought up some really good points there. If you feel comfortable to share your story and educate the world on what it's like to have arthritis, then by all means do it. But there's a lot of people too that maybe don't feel comfortable with that, or even don't feel like they have the resources and education to educate others. And that's completely fine too. I also think you had a really good point in, telling those people that you trust, and you can confide in with your arthritis. That's so important because you don't want to hold it all in by yourself. But if, say, someone is in a situation where they don't feel super comfortable sharing their story or they don't really want people to know, I think a really good way to ease into that is to have a little elevator speech of your arthritis. So like you said, you don't need to say, oh, I'm Bailey, I have extended articular juvenile idiopathic arthritis. You can just, say, hey, I have this disease, that this is what it is, this is how it goes, and this is what that means for me. And that's all you need to know. So if you feel like you are in a place where you don't really want to share your whole medical history with somebody, you can just have a little elevator speech or you can keep it to yourself. But a really good place to share, even if you're starting to get into it for the first time, is with somebody else that has arthritis too. So it's so important to get connected and to find somebody else that also has JA, so you can have that resource and that sounding board. If maybe you don't want to tell your school friends, you can tell your arthritis friends.
Absolutely. And let me just say very clearly, it is not your responsibility to educate others, especially as a kid with JA. Yes, you should advocate for yourself when applicable, but that is a learning curve. It is not your responsibility to tell others how they should treat you. You know what you need. If you decide not to tell somebody, that is completely your right. I mean, I didn't tell people in specific situations because I didn't want them to treat me differently. I told other people because I knew they wouldn't. Find your core people, find your support group very early on. And whether that's your family, people with arthritis or people without. I think a great part about the Arthritis Foundation that I found out when I was very young is that there is this huge support network of people who actually get it. I didn't know anyone with juvenile arthritis until I got involved with the Arthritis Foundation, and if this is your first introduction to the foundation, hi,
Welcome.
welcome. We're really great, I promise. Hi, but the Arthritis Foundation has been such a great resource for me. We saw a flyer for a Jingle Bell run in my pediatric rheumatologist's office.
And I think that's actually really interesting because I didn't meet someone with arthritis until I was a sophomore in college. So I'd seen the flyer for the Jingle Bell run in my rheumatology office, but I'd never really acted on it. And let me tell you, I wish I did, because I missed out on camps and JA days and conference and all of those fun things that are such a good resource that the Arthritis Foundation provides to people wherever they're at in their diagnosis journey. So whether you are newly diagnosed or you have had arthritis for 10 years and you just want to get involved now, like there's no right time to get connected and to find your people with arthritis.
And you talked about the conference as well. That was a great resource. If you, especially if parents have young kids, or if you just want to meet so many people with juvenile arthritis all packed into a hotel, it's the best. It's the best. But yeah, that was a great resource for me too.
I love that you had such a good connection at the JA conference. I actually just went to my first JA conference as a staff person in 2022. So I had never experienced the magic that is JA conference until this year. And oh my gosh, it is absolutely life-changing. I've been very lucky that although I didn't get to do camp when I was a kid, I got to help with camp as a volunteer. So I still got to go to camp and be a counselor and do all of that fun stuff. But camps and JA days and conferences really do just change your life. What is one thing that you think that if you could tell somebody that has arthritis, whether they're newly diagnosed or have maybe had it for a while and haven't got connected, what would be the most important thing that you think that they need to know?
Find your people. Your support group is going to be who you rely on when you have a bad pain day. Know who to go to. When you just really want to rant because your insurance company won't approve your medication, I don't know. Find somebody to go to. And that doesn't have to be the same person. That doesn't have to be a big group of people. Find either your family or your friends, somebody who knows you for you, not for you with the disease. Mm-hmm. And it's okay to rely on people. Now, I would also say, learn how to speak up for yourself. And a good place to do that is the doctor's office. Because even though your parents may be watching or something, nobody knows your body better than you do. So a great way to maybe start with that self-advocacy that Bailey and I talked about would be talk to your doctor about how you feel. You can send your parents out of the room. Nobody cares. I promise you that if you tell your rheumatologist that you want to speak for yourself, they will help you. And if you need any other help, that's why this podcast exists. So find your resources, find your people, and learn, your limits and how to speak up for yourself.
I totally agree. And I think that there's ways to learn how to do it. And the first step is to not take a backseat to your own diagnosis. I know for me in specific, I kind of let my mom do all of the things. And now I'm in this situation where as soon as I turned, I actually stayed until I was 19 at my pediatric rheumatologist because I went away to college. But as soon as I went to my first adult rheumatologist, my mom didn't go with me. I was there by myself. I didn't know how to fill out the paperwork. I didn't know what to put. There's so many different ways to get involved in your own health, but the first one is just don't take a backseat to it. Pay attention when your parents are helping you. Speak up, like you said, when you can, and do your own research and have fun. But I think that those were all fantastic points. I think that it's so important to have your own team, and also just understanding yourself and your body and what you can do. I mean, although I couldn't play soccer anymore, I still played basketball, volleyball, and golf in high school. You just don't let arthritis control
I quit
your life.
soccer too.
Dang soccer. It's just too hard on our joints.
Soccer quitters unite.
We're doing the best we can. But
we're trying.
No, I think that this was a great first episode and a first look into what it's like to have arthritis and different perspectives. A couple other things that we'll be discussing on this podcast series is we'll be communicating with your doctor. We'll be talking to siblings and seeing what that's like. I mean, Kate, what are some of the other topics that we're going to discuss in this series?
Yeah, hilariously, you'll hear from my pediatric rheumatologist, Dr. Heather Von Mater, who is absolutely lovely. You'll hear about 504 plans and, what that means in schools and a way that you can advocate for yourself without having to say everything. Your school can help you too. So that's a great thing we'll talk about. And then, yes, this podcast is for kids, but we also do want to include our parents. So you'll hear from them as well. We'll have a good discussion. And yeah, I'm just so excited for everybody to hear what they can do with this disease. Arthritis, I was talking to my college counselor because I'm 18, I'm going to college. And he said, Kate, your arthritis was really a blessing in disguise for you because you have become such a powerful young woman because you learned from an early age to speak up for yourself. You learned what you cared about. I mean, having a diagnosis thrust me into a space of public advocacy that I would not have been in otherwise. And so I just think it's a really powerful tool. And you're going to learn how to use it.
I think that just like you said, my arthritis made me who I am today. I wouldn't have a job with the Arthritis Foundation if it wasn't for having arthritis. So, we're all about taking the positives for what could be a very negative situation. We're going to flip the mindset and turn it into a good thing and just discuss all of the different ways that you can grow up with arthritis and just talk JA. So thanks so much for joining, and we will see you on the next episode.
Hi, everyone.
The JA Talks podcast is independently produced by the Arthritis Foundation and our volunteers.